Good afternoon. First of all, I would like to thank Professor Whiteley for the invitation. It is an honor to be here in London. I am Carlos Duran, cardiovascular surgeon and phlebology expert, president of Caracas Vascular Unit from Venezuela. Today, I am going to talk about phlebiophotorejuvenation, PPR for short. PPR is an advanced management of aesthetic alterations of the lower limbs caused by chronic venous disease. Historically, patients have been treated only with sclerotherapy, but it is a mistake to handle reticular veins, spider veins, and truncular veins as a sole procedure. Never before has there been talk of treating the skin problems of the lower limbs caused by venous disease that include pigmentation disorders, lack of collagen, spider veins, truncular veins, and scars from phlebectomy as a whole. We are convinced that the management of the aesthetic alterations of the lower limbs go beyond the treatment of all these consequences. We carried out a survey at the UVC and found that patients have low satisfaction if we only focus on the treatment of spider veins. 99% of patients consider it necessary to treat all aesthetic alterations of the lower limbs together. Now, the main question is it correct to only manage varicose veins and not take into account all the aesthetic alterations of the lower limbs? Absolutely not. It is necessary to treat all aesthetic alterations of the lower limbs in order to achieve higher levels of satisfaction in our patients. With PPR, we combine sclerotherapy and a variety of photonic applicators. ND-YAG 1064 treats reticular veins and spider veins. There are photonic applicators, as you see in the graphs below and above, that obtain more satisfactory results in the patient, taking into account all aesthetic alterations of the lower limbs. Non-ablative fractional blue frax 1550 treats skin textures and stimulates collagen 200 microns. Non-ablative fractional purple frax 1940 rejuvenates superficial skin layers and treats pigmented lesions. Blue IPL 400 treats light pigmentations. Yellow IPL 530 treats light pigmentations, vascular component. Orange IPL 555 treats dark pigmentations. The world has only been treating aesthetic alterations with sclerotherapy and ND-YAG 1064, but we can surpass beyond these procedures with PPR. With PPR, we use state-of-the-art technology, offering a vast and complete solution for all skin alteration treatment that were caused by chronic venous disease. Individual results may vary depending on different factors such as skin phototype, pigmentation severity, patient's consistency, and their response to the treatment. In our experience, PPR is a highly effective technique that improves the appearance of the skin on the lower limbs that were affected by chronic venous disease.